Good evening, class. My name is Dr. Lindani Spanda. I'm currently doing my MBA General at Copperbelt University. So my study will look at the level of education as a determining factor of the number of pregnancies a woman of childbearing age have at a hospital in Livingstone District in Zambia. So the aim of the study would be to see the correlation between the level of education and the fertility rate or the number of children a woman has in Livingstone District in Zambia. So the objectives will be to see if this correlation is existent or non-existent, and secondly, to try and find safe means of contraceptive for child sparing, while least women can be able to attend to their educational needs. So we all know that in this day and age, most women go to school, go to tertiary institutions to attain an education and have a career. And then also on the other hand, they've got this societal responsibility of childbearing. So these two clash because education takes so many years. And then on the other hand, a woman also has a biological clock, after which she might have problems in having children. So we would want to see and try to see if how much the impact this has on the number of children or the fertility rate of women. So higher educated women make better informed reproductive choices. Thus, women's education, contraceptive use, fertility patterns are linked. This was described by Kim J in 2016. Despite multiple studies of high risk fertility patterns, the quantitative impact of women's education and contraceptive use in Zambia Livingstone District is unknown. This study examines women's education, contraceptive use, and high risk fertility habits. We want to see if in Livingstone District in Zambia, women with more education have fewer high risk fertility practices. So this information will be collected using questionnaires with open-ended questions to review opinions, experiences, narratives, and accounts. The questionnaire will seek to explore the participants' position or salary, scale or grade in the institution, and her knowledge and availability of different contraceptives she has at her disposal. The results show that there's an inverse relationship between educational attainment and fertility rates. The more a woman is educated, the less children she has. Then education also may result in postponement of procreation. This is because most women tend to postpone uh, having their first children after finishing their first degree. Then education augments a woman's economic prospects, hence impacting her reproductive decisions. So basically, once a woman has a career, she stands a chance of getting a better paying job. So with that, she will now be able to budget and see how many children she'll be able to look after, like sending them to good schools or proper schools, and taking care of their needs in terms of health wise and others. So it will have an impact in the sense that women would have now to see whether they can afford to look after 2 children, 1 child, or even 10 children, depending on the job that they are doing. Educated women frequently possess enhanced accessibility to information regarding family planning and reproductive health, so granting the greater autonomy over their reproductive choices. So educated women basically they have more access to information compared to uneducated ladies. So basically they would know and be better informed on which type of contraceptives they would want to use. Then in certain societies, women's higher education may coincide with cultural transformations that promote family sizes. Education can alter perceptions of gender roles, influencing choices related to family size. So, Yes, so basically, in this point, we saw that once a woman becomes a working class, some of her roles in the family they change. As a result, she would prefer to have fewer children. So, in conclusion, numerous studies show that education increases contraceptive awareness and use. Education improves reproductive health and lowers infant mortality from poor child rearing. An increased anticipated child survival rate decreases the age for more children. We found that women's desire for more children is negatively connected with her number of living children. Education improves women's paid professional prospects. Our results show that money decreases offspring aspiration. Modern society rarely sees children as a protection from poverty, unlike the African custom. So women gain information to plan their ideal family size through education. Thank you.